Hey everybody, it's me, Rebecca Jones, coming to you with my daily update. So the CDC status update came out today, a few days late, but given the holiday, it's not unexpected. And for Florida nationally, things are getting worse. All of this is per capita, so it's all based on population. Florida is now number 48 in new cases, 45 in positivity, 46 in new hospitalizations, and 52 for deaths. One is the best, which means that you have the lowest rate of those things, and 52 is the worst because it includes the all 50 United States plus Puerto Rico and District of Columbia. And Florida fell from 49 last week for new deaths to 52, so they're now last. The state is reporting a positivity rate of a 3.1% on their website, 3.87% in their data, and the CDC says 4.7%. So multiple competing numbers that get increasingly higher the further you look at the data. 80% of all cases sequenced in the last week were variant cases, the majority which of those, 70%, were B117. And the largest second share of that was P1. Only one time in the last year has positivity been below 5% for the entire state of Florida over a period of 7 days. They have not yet reached that again since October, but it is decreasing, which is great. Testing volume is decreasing. Hospital resources and staff continue to be depleted by a rate of 20% over each previous week. And I wanted to take a special moment to separate from the data, which we're catching up on now, and we'll be switching to weekly because that's what DOH is going to do starting next week. So there will no longer be daily updates by DOH, so there will no longer be daily updates by me. But I wanted to take a moment to recognize some really awful things that are going on in the state of Florida with the governor. On Tuesday, on the first day of June, which is Pride Month, the governor passed a trans athlete ban for high school and college students, which serves no purpose other than to punish children for being different, to enforce this kind of extreme conservative view of how children should behave and the danger that is posed by trans people, which is a false, provably false, statistically false risk. And then Wednesday, yesterday, he cut $150,000 for the victims of the Pulse shooting in Orlando. He was there last year when it happened, offered his sympathies, offered to take care of the survivors, to provide for mental health. And yesterday, just days before the anniversary of the shooting, he cut that funding. Additionally, he cut $750,000 from programs that help house LGBT youth who are kicked out of their homes for being gay. Or being trans or being bi. And he cut $750,000 from homeless children funds, which is just sick. And then today, this morning, he bragged about how Florida followed the science and the data in their reopening plan and thus, saved their economy and did so great. But there are quite a few factual errors about that, starting with the fact that New York is number 6 right now in new deaths and has maintained its provisions, which is why they are among the best for cases and hospitalizations and deaths in the country. Whereas Florida is dead last. They're doing worse than every single other state in the country, plus Puerto Rico and DC, for new deaths. They do not have control of this. They never have. They've been in the bottom 10 every single week since last November. They've never improved. They are ranked right now number 27 for vaccinations, yet they have the highest death rate. Something is not adding up there. It's not making sense. It could be very much travel-based. It could be based on variants, but they're not doing enough sequencing to really know. They're not doing enough studies on breakthrough cases to be able to demonstratively prove that. And without that data, it's really hard to dig into why we see those conditions, but it needs fixed. And I definitely take personal insult when he says he's proud that they kept schools open and businesses opened because more than 120,000 student and school staffs just in the K through 12 environment have tested positive for COVID-19, likely 3 times that many based on enrollment rates and pediatric cases in that district. And the Public Health Accreditation Board spent 6 months investigating DOH and threatened to pull their accreditation for the entire statewide Department of Health if they did not make changes to the data that they were providing the public with COVID-19, specifically regarding schools. They threatened and intimidated school districts like Duval that wanted to come public with information and told them they were not allowed to. They told their county health departments that they were not allowed to advise school districts on whether or not it was safe to safely reopen their schools. Oh, but then they say, he kept business open to the cost of more than 50,000 lives, according to the Institute for Health Metrics. And for what? Poverty increased more in Florida than any other state in the country. More people are behind in rent in Florida than any other state in the country. So the average Floridian did not benefit from that reopening. They did not. And then recently, he also decided to no longer accept the federal money that gave $300 per week to unemployment insurance for those who cannot find a job due to whatever conditions they are seeing. You can't find one, or they're sick, or they're taking care of a loved one who's sick, or they have children who they do not feel is safe to go to school. Add to that the oppressive voting restrictions that have been passed, his pay-for-play vaccine dilemma, which had nothing to do with me, and literally targeting scientists and doctors who speak out, which is related to me, including myself, who's now a protected whistleblower under Florida statutes. And why would anyone ever vote for this man? He hurts children. He puts them in harm's way to further his economic and political agenda. He sent armed police to my house to point guns at my children and steal my technology to try to shut me up because I was reporting about their discrepancies in schools' data. And getting a statement of probable cause from the Department of Health Inspector General, as unexpected as it was probably the biggest show and biggest indictment so far that DOH did everything that I said they did. They said that they found probable cause to suspect that the individuals I named, including Shamiriel Roberson and Karina Blackmore, falsified and misled the public on COVID-19 data, and that led to a specific and immediate risk to the health and safety of the people of Florida. Coming from DOH, which we never expected, that's huge. And while we're not hopeful that the agency will ultimately find in my favor with all allegations, we have the truth, and we will keep fighting for that. And that is what really matters. So please make sure tomorrow morning you pick up the Miami Herald, because it will change your life. It will change Florida's life forever. And that's what we're here for, to help people. So I will see you guys later.